Hairs are a very important part of the beauty of any female, and so is the hairline. If the hairline is not at the normal level, it is starting behind from the normal level, then it can make the harmony of the face disturbed, and also it can make any female look older or maybe sometimes masculine. Hello everyone, I am Dr. Lokesh Handa, Senior Consultant Plastic Surgeon, and I will be talking about the advancement of the female hairline or forehead reduction. And this is usually indicated in females whose forehead is quite broad. That means the hairs are starting not at the normal level, they are starting quite behind from the normal hairline. And this is usually seen in females which have this hairline either by birth, or it can be because of what we call as traction alopecia. Traction means that if the female is tying her hairs very tightly, so over a period of time the hairs from the forehead they start disappearing, and then the hairline it recedes back. Or sometimes it can be because of the ethnicity. That means the shape of the skull is such that the hairs look as if the forehead is very short, and it looks as if the hairline is starting from quite behind. So in these cases we need to do what we call as forehead reduction or the female hairline advancement procedures. Now, how these procedures are done? There are two ways to reduce this forehead. One is by cutting the skin of the forehead and advancing the skin flap, which is a hair bearing flap, and stitching it at the hairline level. But then what happens is that there is a scar which forms at the hairline. Now, if this scar is not good over a period of time, it expands or it becomes dark, then it looks very bad or it looks very ugly on that hairline. So either we will have to camouflage it by doing some hair transplant on the scar, or we have to revise the scar, and there could be some problems in the forehead where after this scar this area can become numb. So to avoid all these problems, the other second method of the hairline of the forehead reduction is the hairline advancement by doing hair transplant. That means if the forehead is quite broad, then we draw the hairline, which is usually heart shaped, and then we do the hair transplant in this. The hair transplant can be done either by FUE technique, wherein we take single hairs from the back of the scalp, or we can do it by FUT strip method, wherein we take just a small strip of skin from the back and then separate single follicles from the strip and place them in the forehead region. So once the hair transplant is done, then over a period of time, once the hairs grow, then the forehead will have hairs and this forehead will be reduced. Now, to make this look very natural, we have to pack this area where we are doing hair transplant in a very dense manner. Only then the success of this procedure will be revealed. If the hairs are not packed densely, then it will not be aesthetically pleasing, and either you will have to do the procedure twice, or patient will not be very happy about the overall results of the procedure. So for this procedure to be successful, you have to have a very good and aesthetic skills to do the hair transplant for the female hairline advancement procedures. And how we determine the facial disharmony? We basically divide the face in three equal parts: from below the nose up to the chin, then the height of the nose, and from the top of the nose till the hairline. So these three parts should be equal. So the hairline in the females, that should start from the point which is equal to these thirds. So that point is the point where we start the hairline, and whatever the hairline, the original hairline is in between, so we have to cover that portion with the hair transplant. So for any query regarding this female hairline advancement procedure, you can call on the mentioned number. Me and my team will be willing to help you sort all the queries. Thank you.